InnovAge PACE helps thousands of seniors get the care and support that they need to live happier, healthier, more independent lives. But what you may not know is just how much they actually do help folks, financially as well. In today's sponsored segment, we're joined by Melanie Koll, who is the Eligibility and Financial Determination Controller for InnovAge PACE. Nice to see you, Melanie.
Nice to see you as well.
So let's talk a little bit about people who don't know about InnovAge PACE. The program really is an all-inclusive place where seniors can go. How does it work?
So with it being all-inclusive, that basically means it's like a one-stop shop. So people, when they're coming in, they can come in for any kind of, like their primary care physician will be there. They can see specialists there. They have social programs that they can access there. Mm-hmm. You can do dental work there.
Wow.
It's really,
it really is a one-stop shop.
All-inclusive, yeah. And there's also transportation that we offer, and you know, you get to see other people that are in the same boat, and they get to do social activities together. So it's really a good program.
This is a blessing for so many people. I went through helping my mom and dad, and it's difficult to do.
It's very difficult.
So when you have someone like InnovAge, that's huge. But you don't automatically just get accepted. There's like a process, correct?
That's correct, yes. So the eligibility criteria for PACE itself, you have to be 55 years old. You have to have nursing level of care needs, which basically means that you would need assistance with the daily activities of living, so you would need help with that. And then you have to live near a PACE center to be eligible, and that's just PACE.
And that's just PACE. Okay, well, we had a chance to talk to one of your enrollment specialists, and they shared some of the participants and shared some news about what's happening. Let's take a listen.
It's a big relief. Yeah. You got people that they know people that they can talk to that I wouldn't know anything about. InnovAge, they take the biggest load off of you. They do all the paperwork and all that.
So we were working with our therapy department, medication, our nursing staff, social work, you name it. It can be very convoluted, very complicated for these families because they don't have the means to do so themselves, or their families don't have the time because they're busy working, raising their own families, various other things. So us as individuals, as enrollment and outreach, we go out and actually help them through that process and figuring out their financials and making that a very seamless process for them to ease that burden.
You don't have to worry about making payments every month on something like health insurance and all that. And you don't have to buy those plans or, you know, like they try to sell you. But no, they take care of it all.
Well, it's not difficult to understand like how hard this can be both on seniors and then also families when you are put in this situation.
Right, that's correct. It's a lot because by the time seniors typically get to the point where they need to start looking for care, family members, they're experiencing caretaker burnout.
Yeah.
They've waited too long. They haven't prepared up front. You know, over earlier times, they haven't like collected things and kept track of things. So it becomes a crisis, and so they're in crisis mode at that point, and they're trying to hurry up and get somebody in the program, and that's not really allowing them the time to prepare because it is a process. You have to be eligible, especially if you're applying for Medicaid.
And that's where you come in, thank goodness, because when people think about financial, they just think of numbers, but there's so much more. There's a lot of paperwork.
So much more. And yeah, we have the enrollment team, and then we have my team, which is the eligibility and financial determination team. And we walk our applicants through that process for applying for Medicaid, which is the majority of the people that apply. They want to go for Medicaid. Medicaid will pay for the program, which is a fantastic opportunity for so many people to get in there. But it's detailed. You have to meet certain financial criteria, income and resources. So our team will do that. The enrollment reps, they meet with them and they help them face to face. It's a one-on-one process. And then my specialists will go through and they will review everything and make sure that they're eligible.
Melanie, we have like 10 seconds left.
Sure.
Anything you want the people to know at home watching about InnovAge PACE?
I do. Prepare early.
Yeah.
Don't wait until it's a crisis. You want to make sure that you're saving things start planning 5 years ahead because Medicaid can look back 5 years. Get a manila envelope and start stuffing stuff in there because that's
Great
what you're
advice.
going to need.
Thank you so much for coming
You're
on the
welcome.
show and all the hard work that you do. Takes a team. The InnovAge team is happy to help you evaluate your options. Go ahead and see if you are eligible for the program and share more on how PACE can fit your particular healthcare needs. Learn more right now. Reach out to them. InnovAge's center staff, they're ready to help you in your area. They're also happy to give you and your loved ones a tour. You can also visit InnovAge.com. That's InnovAge.com for more information. And thanks to InnovAge PACE for sponsoring this segment.